Oi, Bonita. Welcome back to the Be Bonita podcast. I'm your host, Viviane, and today we have a very special guest. We met at a great event about menopause a few weeks or months ago, and I just love the way she was speaking about pelvic health, and was very unique and holistic, which is my approach as well. So I said, "Oh my gosh, I can't wait to have her and my podcast." So please, let's give a round of applause to Hina Shefeth.
Chef.
Chef. You know how many times I was practicing to say your last name, and I was like, I got it. I got it. And I watched, some of your videos, and I was like, I got her name. I got her name. And then I messed up. I'm so sorry. But okay. Yeah, so tell us a little bit about your what inspired you to get into a very specific training, or even what led you to study physical therapy first.
Yeah, so I first, just like most physical therapists, loved being, I was an athlete, and so I loved working in the sports world. So what better occupation than working with other athletes? And once I went into school and I did a lot of internships, I quickly realized that, I really want to make a bigger difference in the physical therapy world. And being in the sports physical therapy world, it was going to be a very, very, very big mountain to climb to try and make that difference. And there were two women that came in. I graduated in 2000, so a long time ago. But I remember back then, two women came in and they said, hey, this is an area that we really need a lot of help. There's not many people that want to do this, but we think that all women need pelvic floor help. And back then, it was more about incontinence, or postpartum incontinence. And so I didn't exactly know how big it was going to get. But I was like, oh, that's interesting. It's new. It's a place I can, pioneer a little bit. And so I did an internship and I loved it. I was able to spend so much more time with my clients. I was seeing just so much outside of just incontinence. We were seeing pelvic pain. We were seeing just a lot of musculoskeletal things around the hip and the pelvis and the back, and how everything kind of connects together, which really empowered me to really dive into that. But I was also having a lot of family members that were having painful intercourse, but in our culture, we don't necessarily talk about it. Yeah. But they would ask me questions because they knew I was in the specialty. They're like, I haven't told anybody about this, but I have this problem. And because I would talk about what I would do, people would be like, oh, I have a question for you. Can I ask you in private? But that's how it really inspired me. And then I basically did I did work in a sports orthopedic clinic, so I could really learn a solid orthopedic background. But then when I moved to Pennsylvania, I really started integrating both orthopedics and pelvic floor therapy together. And that has just been just the most amazing thing to really learn about the body, literally from the inside out.
Literally, literally.
Yeah.
And you tell me if I'm wrong, but being a woman also add a lot of weight for you to specialize in this area.
Yes, it did, because I felt like there was that connection, just woman to woman. However, we treat a lot of men. So because lots of men have pelvic floor dysfunction, but again, this is actually the one place where I would say women have a big advantage over men. Because at least with women now, after, now I see it 25 years later, where the healthcare community is starting to recognize that pelvic floor is a thing with women. And with men, it's just starting to, it's almost like we're still 20 years back with men. And so women can go to gynecologists, they can go to urogynecologists, they can go to urologists, and they all
comfortable
well, sorta. Gynecologists more so, some urologists, and urogynecologists, I would say for sure. But many of them, at least in the bigger cosmopolitan cities, recognize that pelvic floor is, you know, a dysfunction, and that could be the cause of pain for many women, obviously incontinence, prolapse, all that kind of stuff. But for men, they really only see urologists, and a lot of the urologists don't they don't always know that a pelvic floor issue can cause male pelvic pain and male sexual issues. So that's I would say women have the upper hand there.
Would it be because we're designed to give birth?
That we have more pelvic floor issues? Or
No, actually being able to not have issues because it was built to be able to expand, to give life. I don't know. I'm thinking,
yeah,
you
you're
know?
thinking outside the box. Yeah, I mean, definitely I would say there's more women that end up having pelvic floor dysfunction, significantly more women. I think it's one in every 3 women, which is a lot. End up having pelvic floor issues, whether it's because of these muscles becoming weak or these muscles becoming tight.
Yes.
And birth, it is, even though it's a beautiful miracle, it also causes
Traumatic.
It's very traumatic for the body. And so for some women, they bounce back super quick, but for other women, it doesn't bounce back as quick. And so for them, there's a lot of things that become unbalanced. And so you need to create that balance again. For men, it's actually, I feel like, a very different, sometimes a different origin of why it happens. For men, I feel like it's a lot more geared towards stress. For women too, but there's a lot of other things.
And probably, as you said, the doctors they probably study in medical school, but they forget that everything is connected.
Yes, that is huge. There are many, I would say there are still many physicians that don't realize that, there's muscles down there that, that actually play a huge role. And I'm sure we're going to get into this, but play a huge role in literally from head to toe. Your pelvic floor is a big, important piece.
So I have to share this, a personal experience. I had a total hip replacement 2020.
Yeah.
And my left side. And for many years, I would say the past decade, I was thinking that was sciatic nerve. And so my background is massage therapy, right? Yeah. So I was just addressing through acupuncture, through stretch, and I finally went to the doctor. The pain didn't dissipate, and it got to a point where at the end of the day I was limping, and I was overcompensating my right side. And so went to the doctor, got the x-ray, and then come to find out severe arthritis, bone to bone.
That was on the left side?
On the left side.
Okay.
So now, years later, in 2020, I got the surgery, and I was like, great. But the overcompensated side affected also now my back, affected also a lot of discomfort on my right side.
Yeah.
And even standing, I feel my body is off, and I have worked with a chiropractor, and he was like, you okay, you okay. But I feel in my body that I'm not grounded on the pelvic level. Yeah. Even in my feet standing, there is off balance there. And I was, as I was researching, your work, you talk about also becoming aware of the muscles around the hip.
Yeah.
That led me to think, of course, that's why I know why I'm off balance, because I, as a massage therapist, I understand the muscle. I don't know the names anymore, but I understand that the connection between the muscles, especially the core and also the middle section, right? Yeah. So with pregnancy as well, and menopause, we're going to talk about menopause as well. I also noticed that I pee more often. I don't have the strength to hold. So I learned that the Kegels exercises will help with that. And you're a little like, yeah, but they don't work. So tell us why you think that it doesn't work, and explain what Kegel's exercise are.
Yeah, and I wouldn't say that Kegels don't work. For some people, they do Kegels, and it's the best thing, and it cures their incontinence or prolapse or whatever issues. But I think what people need to realize is the pelvic floor is not one muscle. It's 14 muscles. So if any of those muscles are imbalanced, meaning some are weak, some are tight, then you can do a Kegel's contraction, which creates tightening of all of those 14 muscles, if you're doing it correctly. It tightens all those 14 muscles. But let's say 7 of those muscles are tight. You're basically creating a contraction, which is a tightening of muscles that are already tight. And so those muscles, a tight muscle is an inefficient muscle. So if you're tightening those muscles even further, then you're not actually improving.
Training the muscles.
You're not training the muscles right. You're actually just creating more tightness, which creates more inefficiency. And so for those 7 muscles that might be tight, you actually need to do the opposite. You actually have to lengthen those muscles. And then once everything is basically at a normal tone, not a tighter tone, but a normal tone, now you can strengthen on a better, efficient muscle. And so now that muscle will work better. So I think for a lot of people, if they are doing Kegels and it's not giving them the results that they want, there could be, there could be tight muscles in your pelvic floor. And there's reasons why certain muscles become tight and why that happens, but it could be that. Yeah.
Aging is one of them?
What'd you say?
Aging
is a funny thing. Because we've had women, that, because you think when you age, your estrogen goes down. And that creates laxity and kind of droopiness in your muscles, and things become weak. And that does happen. But also what can happen is, as you also age, things can become on the tighter side because your myofascia also isn't as healthy. And so if you have, let's say, a urinary tract infection, or you have any type of surgery or anything like that, that can all form scar tissue. Even infections, like active infections, even once the infection is gone, it can actually have a lasting effect on all the musculature within the pelvic floor and within the myofascia and around the organs, the fascial organs, or the fascia around the organs. It can cause tightening of that. And so we have women, that will come in and they'll have tight pelvic floor, but they'll also have weak. So they can also be what's called a mixed pelvic floor.
Okay.
Yes.
Okay. Well, we're already talking about menopause.
Yeah.
Might as well just go there, right?
Yeah.
So what is the connection between like the pelvic floor and menopause?
Yeah. So pelvic floor is like a hammock. It basically attaches, it's the pelvic floor muscles are inside of the pelvis, which is like a bowl, and it attaches from the front part of your pelvis to the back, so tailbone to the pubic bone, and then both sides of your sit bones, so literally the bones you sit on all day. And so as menopause kind of sits in, estrogen kind of starts to decline, your muscles and the fascia that we talked about, that trampoline needs estrogen to kind of maintain that plumpness
That
and
bounce.
the strength and the integrity. But that starts to decline. So when that happens, you don't have as much integrity for the pelvic floor muscles, which basically support the pelvic organs. So the bladder, the uterus, and the rectum all are supported by this trampoline. And so if that trampoline starts to sag, just like if someone was standing on that trampoline, as it'll start to sag. And so that's what happens with the organs. The organs, if they are also, vulnerable, they can start to kind of fall, and that's what's called a prolapse. So with menopause, you start to see this change in the pelvic floor That's one of the changes, is that you start to lose the integrity of it, and that can have an effect on the pelvic organs. And then that also can lead to incontinence issues too, because you don't have the strength of the pelvic floor to kind of clamp down the bladder and hold it stable. But the other thing that can happen is with menopause, you also have a change in the pH of the vagina, right?
Yeah.
The pH changes, and you become more vulnerable to things like urinary tract infections and yeast infections and things like that. And when that happens, just like I was saying before, when you end up getting, for many people, chronic infections, the pelvic floor will actually react to that and become dysfunctional and tight. And so that is another result that we see with menopause, is that you start to see myofascial and muscular changes within the pelvic floor, so it becomes tight. So now you have a weakness and a tightness kind of going on for some people as they go through menopause. And so those are kind of the two biggest changes that we see with like depletion of estrogen. And so, so you'll see more of that.
So then would you say that will be under the pelvic dysfunction? Like under the problems, or you understand where I'm trying to go?
Yeah, so you're saying maybe.
That being an issue or a condition that is caused by menopause, would that be under, hey, these are the pelvic dysfunction symptoms?
Yes. So basically I would say it can be chicken or egg, I would say. Because if you've already had pelvic floor issues because of either birth or previous, like anything from even like, I would say, anything that leads to pelvic floor tightness or weakness. So that could be pregnancy, for some
trauma.
What'd you say?
Like sexual
trauma. Yes, that can lead to tightness of your pelvic floor because there's a lot of guarding that develops. I'll also put stress underneath there, because with a lot of stress, people tend to clench their pelvic floor and they have no idea that they're doing it. Like I said, any type of surgery. Also things like endometriosis.
Yes.
Those sorts of kind of diagnoses as well, irritable bowel. So any type of GI dysfunction, that can all lead to changes within the pelvic floor. People have no idea that their pelvic floor is changing. Now you hit menopause, and now you layer on pH changes, lack of estrogen, and all of a sudden their pelvic floor becomes a problem. But they maybe have already had stuff in the past, baggage kind of starting in the pelvic floor, and then just menopause is kind of like the next layer. It's like the icing on the cake that just kind of snowballs the effect of it.
It makes sense. Makes a lot of sense. Everything during menopause just amplifies.
Exactly. Yeah, exactly. Musculoskeletal pain amplifies. Pelvic floor dysfunction amplifies. Yep.
Is there any particular posture that we have a tendency to overcompensate throughout the day that is unconscious, that is a problem for the pelvic floor?
Yes. So it's funny. So I did a TEDx talk, and one of the things I talked about at the very end is I talked about butt gripping posture.
That's why I came up with that question.
So most people don't even realize it, but they grip their glutes all day long. And they have no idea that they're doing it.
Me.
Yeah.
I mean, unfortunately,
it's very common.
Yeah.
And I did it too after I had all three of my kids, because I was so unstable. Right? You're pregnant for 9 months. You kind of adapt to that posture, and then you have a baby within like 24 hours, and now you have to adapt to a whole new posturing. And the easiest thing to do is clench your butt to kind of hold you stable. And then people don't even realize that they're doing that. And that will actually end up tightening up the back of the pelvic floor. So remember that trampoline, you'll start to tighten the back of the trampoline, and then the front becomes weak. Or it can go vice versa with other posturing, for example, is and you see this in young girls a lot, is when they're over tightening their abdominal muscles. And so, they'll try and like suck in to hold their abdominals. I grew
up with that.
Yeah. And you hear moms say it a long time ago, like, tighten up your abs and stand up straight.
Big time.
Yeah.
And I feel like that's my posture. And I noticed I did like a very speed training on breath work with a good friend of mine. He's an acupuncturist and trained as a teacher. I realized that I have been breathing completely different with that old thinking of the belly, holding the belly.
Hold the belly in.
Once he showed me, and I was like, oh my gosh, for 40-something years I've been doing this incorrectly because of the training. Oh, suck your belly in, suck your belly in.
Yep.
And that affect a lot of the quality of my sleep.
Yeah.
And I didn't know.
Yeah. And it's interesting you say that, because when you do tighten up the abdominals, then you tend to tighten up the front of the pelvic floor. But it actually changes the way you breathe. And again, most people don't realize this, but the diaphragm, which is your breathing muscle, is completely synchronized with your pelvic floor. So when you breathe in and that diaphragm contracts and goes down, your pelvic floor relaxes. And then when you breathe out, your pelvic floor has a slight contraction. So there's this pistoning effect that actually then massages the inside of your organs. So it's really important that people learn how to breathe correctly. And they're even now going further in how the pelvic floor, the diaphragm, and actually the larynx, how they're all connected together. So even the way that you talk affects the way your pelvic floor behaves. And so you see, for many people, like you'll see opera singers.
Oh yeah, the work of the diaphragm.
The work of the diaphragm, but they'll come in with pelvic floor dysfunction. Wow. So we've had opera singers come into our clinic, that want pelvic floor help because they're finding that that's actually affecting their diaphragm, that then is affecting their ability to really hit the higher notes. And we'll even have moms. So this was funny. We had a mom come in the other day, and she was saying, I only have incontinence when I really have to yell at my kids. So she's like, it's when I hit those high notes and yelling at my kids. She goes, that I leak. And so, your voice and your breath and your diaphragm and your pelvic floor, it's all interconnected together. It's really fascinating.
Wow.
Yeah.
See, that's what I love.
Yeah.
Yeah. So I have a specific question. I'm going to read it. Why do you think pelvic floor health is often left out of the conversation about menopause, especially in the community of color? And it's based on, and for me, I feel like it's about the training that some specialists don't understand, or lifestyle and habits to be able to pinpoint, hey, this might be a problem with pelvic floor, is dismissed because pain is related to strength, and strength, that's what we have. We can be and deal with pain not in your business, because you own your practice, which is a beautiful thing, but within the experience and working with other practices, have you noticed any difference how they approach assessing the body or the issue of a woman of color? That could be Indian descent, that could be an African descent, Brazilian descent of color. Did you notice that there is a different way to assess or diagnose?
Yeah, I wouldn't say. I think there's a couple of things in this. I think number one, let's address the issue of like menopause and pelvic floor dysfunction and why they're not often connected. And again, everything is improving. So I have to say, like,
yes, I agree.
From 25 years ago, it is like a completely different world, which is great. I think before there wasn't a whole lot of talk in it because there wasn't a lot of, number one, there wasn't a whole lot of research.
Information.
With just pelvic floor in general. pelvic floor therapy only really, I would say, the research, and I was fortunate to be one of the practitioners in the first NIH study that they did for pelvic floor and myofascial work together to heal pelvic pain. And that really put pelvic floor therapy on the map for urogynecologists and gynecologists that were dealing with women with like, bladder cystitis as well as like endometriosis and things like that. So number one, I think there wasn't a whole lot of research done. So people weren't referring to pelvic floor therapy. So that has just recently, I would say in the last 10 years, it's really blown up. So I think now with menopause, and menopause wasn't given a whole lot of attention at all. I feel like menopause is just blown up in the last 2 years.
Yeah.
You're right.
I would
become
agree.
huge.
Yeah.
And so now I think they're starting to make that menopause is getting a lot of attention and spotlight, but now there's a whole nother step of connecting menopause to pelvic floor, right? And that's just starting to happen. And so I think that has a big piece of it. And because now the gynecologists and the urogynecologists are starting to understand more about how pelvic floor is connected to all of this, now I'm hoping that this will create more awareness. But I think there wasn't that awareness. And again, at least here in Philadelphia, I know this because I lecture to all the, a lot of the healthcare systems for the GYN residents and for the urogynecology residents. So I end up doing, I'm usually the only lecturer on pelvic floor.
Wow.
Well, it was when I started, like when I moved here in 2004. So I do think it's changing. I think it's improving, but I think there has been that barrier for a long time because the knowledge wasn't there. You only get like one little lecture, which was like from me. But now at least now the professors are actually starting to talk about it more. And then as far as in the community of color, I think that that's another whole different can of worms because obviously there are studies and there's research out there that there is healthcare bias, unfortunately. And especially with communities of color. And so I think when someone of color comes in and there's pain, they may not get the full attention of, okay, let's really look into this. Again, it's not fair, it's not right, but unfortunately it exists. And so I think, but again, I don't see that as much in a private practice because everybody gets 100% of our attention. But I do see this when I did work in a hospital system. You just saw that bias there, that people of color just didn't get sometimes as much attention as somebody who came in that was of non-color. And I also think the other thing is that sometimes I also saw this in the community where I almost felt like people of color also felt like they didn't speak out they didn't advocate as much.
Yeah.
I also saw that too. It's almost like I would tell them what to do, but they would never ask me questions. They would never question what I told them to do. But I see this also in the Indian community. Yeah. They just believe everything that they hear. Whereas, I don't people of non-color, I would say, your Caucasian patients
they're more advocate.
They will self-advocate. They will question everything that you do, and they will go back and research what you told them. And so I think it's a little bit of both.
I agree. My experience as a licensed esthetician, massage therapist, most of my career I worked in the European-ish environment where the experience is different and the service is different. And the commitment is different because there is the financial piece as well that they can, afford to take care of themselves.
Yes.
Right.
Yeah.
But also agree that with this age of information now, I have clients of color that they come in with a research like, hey, I did my research. What do you think about this? What do you think about that? They already know. But when it comes to health, even in Brazil, like my mother, talking to my mom today, And I said, Mom, do this exercise, do this. And then, no, the doctor said I can hurt my. No, you are choosing to just follow by what the doctor's saying, but you actually can do these exercises and get better. She has some back issues. Mm-hmm. So I think it's the programming.
Yeah. And
the authority of the doctor, whatever they say, I'm going to do it. Yeah. Not knowing that this is your body. Yeah. And understanding how it functions. Our parents and grandparents might be like, but the new generation, now your kids, now they see that they have full agency of their own health because their mother is a body worker, right? Yeah. And a teacher, so they understand that. Oh, now let me do what Mama was saying now because it works. Yeah. And they tell their friends around that age. They have better understanding about the body because of the TikToks and Instagram and YouTube.
Exactly.
Right?
And I was just about to say, social media has it's been a good thing and not such a good thing.
I know.
Right? But
a lot of misinformation.
But it has been amazing in certain areas where people are getting educated, especially in the pelvic floor world. Like we never had moms come in that said, "Hey, I want to make sure my pelvic floor is doing okay." When do people come in for wellness of their pelvic floor? And now we have so many women coming in, after they've had babies because their doctors aren't even telling them. They're choosing to come and see us to make sure everything's okay. And I think that's because of social media.
I agree 100%. Yeah. I agree 100%. This conversation is delicious.
Yeah, I love it.
Can you share with us like three quick hacks that we can strengthen or even become aware of our pelvic muscles that we can try at home, sitting, standing, to really getting familiar with the pelvic muscles? Share with us.
Yeah, so like I had mentioned, you've got these 14 pelvic floor muscles that sit inside your pelvis. Most people have no idea that they have them. But you'll recognize them because let's say if you're going to the bathroom and you're peeing and you need to hold your pee back or you can't find a bathroom. The muscles that you are tightening to hold your pee back are basically your pelvic floor muscles if you are using the right muscles. But a lot of people aren't using the right muscles. And so you need to recognize where they are. So I basically say, and the breath work is also really important to make sure you're doing it right. So I would say one of the biggest things is a lot of people now understand what diaphragmatic breathing is. But if you take it a step further, I call it 360 breathing. So diaphragmatic breathing, if you listen, if you go to yoga classes and also if you look on YouTube and things like that, a lot of it is educated in belly breathing, where you breathe in and your belly, expands out and goes back in. But the diaphragm is kind of like an umbrella around the rib cage, and the rib cage goes all the way to the back. So if you imagine that the diaphragm is an umbrella opening up from the front as well as the back, then I want you to almost think that when you take a breath in, that you're expanding not only your belly, but the sides of your rib cage and your back. So
I'm breathing here.
Yeah, I hear it. Yeah. So you should feel that now that breath feels more circumferential around the rib cage.
I felt it, yeah.
Now, when you do that, what you should feel is that your pelvic floor muscles should actually relax as you breathe in. So imagine that your sit bones are becoming wider as you take a breath in. So the bones that you're sitting on, if you can breathe in and imagine that the bones you're sitting on are expanding away from each other, you should feel something kind of ballooning out, like an expansion.
Yeah, I'm feeling right now.
So those are your pelvic floor muscles.
Okay.
And that is actually what should happen. As you breathe in, your pelvic floor muscles should relax and open up wide. The other two sides, so not only your sit bones, but your pubic bone, which is the bone in the front, and your tailbone should also expand. So it expands laterally
Sideways.
and forward and backwards. So that's how you expand your pelvic floor muscles. Now, in order to contract your pelvic floor muscles, now you take a breath out and you imagine that the sit bones are coming together and the pubic bone and the tailbone is coming together at the same time. And when you do that, so if you breathe in, everything expands. When you breathe out, everything comes together. And you should feel a contraction that almost feels like you're feeling tension around not only the vaginal opening, but also the rectal opening. And it should be kind of doing it together. So I would say that's like my quick go-to to know whether you're doing a pelvic floor contraction, at least getting the coordination of it. Doesn't mean everything's perfectly symmetrical, but that's how to connect with your pelvic floor. And then that same idea of as you take a breath in, some people don't breathe. They use a lot of neck muscles to breathe. They use a lot of neck muscles to breathe. So sometimes I'll even tell people, like, put your hand on the sides of your neck muscles and see if you can, like, breathe in with keeping your neck muscles completely relaxed. And try and do that 360 breath and then expand it into your pelvic floor. And as you do that, that will hopefully be you're not compensating with the wrong neck muscles to breathe. But then a lot of people compensate poorly with the opposite when you actually breathe out and contract your pelvic floor. So when you contract your pelvic floor, what you want to make sure is you're not squeezing your butt muscles, you're not squeezing your inner thigh muscles, and you're not overly contracting your big abdominal muscles. So it should be very subtle. And you shouldn't feel any of those other muscles when you do the opposite. So that's kind of like your way to figure out whether you either don't know what you're kind of listening to me and you're like, I have, that's not what's happening in my body. Well, then that's when a good pelvic floor therapist
can show you the muscles and work with you. And that's why you can book a session with Hina, okay? Go to Rebalance Physical Therapy. We're going to talk about that. But before we go, I have another question that I'm curious. When it comes to like sexual activities, is any way that you could work with your partner to strengthen or the pelvic floor or anything that you have around being sexually active, if you have a partner, if you have painful intercourse, how that woman that is experiencing that can work, to alleviate that.
So this can be different for different women because we see a lot of patients that have pain with intercourse at our clinic, and that's one symptom of pelvic floor. Which before we go, we should probably talk about what to look for if you have pelvic floor stuff.
Absolutely.
But when you're having sexual pain, people come in with at different levels. Some people can have intercourse, but it's just painful. But their partner can, like they can fully penetrate and they can have an orgasm and all that kind of stuff. And there are some people who have to stop in the middle because it becomes too painful. And then there are others that cannot even engage in intercourse. So depending on the level that you're at, we'll actually sometimes have the partners come in if they want to be involved in their care. So for someone who cannot have intercourse at all, then trying to teach them how to be supportive in just like foreplay. We work with a lot of also psychologists and counselors that also are sex therapists. So we sometimes work with them because it does affect the psyche so much when you feel like you don't feel normal. And so, just teaching them like, hey, there's other ways that you can like work on certain massage techniques. Like here are ways you can release trigger points with your partner. Some partners will come in and they'll be like, I'll do the internal work and help my wife or partner or whoever. I'll help them do that. And so we'll teach the partners how to do that. And so that goes for all three levels. The ones that are, sometimes coming in that can have intercourse, but they can't complete it, or they can complete it, but it's just painful. Then there's little gadgets that you can use to actually make the penis more shallow. And so we'll teach their partners, like, hey, here is, there's something called the O-nut, which you can place around like the penile shaft and make the penis shorter. So that way and it apparently feels still just as good for the partner, but the woman who's having painful intercourse, it doesn't feel as deep. It feels shallower. So there's, that. And then plus there's also lots of different techniques that you can teach the partner to just be supportive in, just in terms of like teaching them how to treat their wife.
Hey.
Yeah.
Hey, I don't have that problem. I'm just asking for you, Bonitas, but I don't have that problem. So, and I remember also doing the research that the pelvic floor also, because it's connected to the whole body.
Yeah.
Then we start also having, if you don't have a stable, balanced pelvic floor, then it's affecting other areas, like giving, back pains. Can we talk about like how it looks like when the pelvic floor is not?
Yeah. So pelvic floor can be involved in a lot of, first we're going to just talk about quickly orthopedics. So you know how you were saying like you had a hip replacement on one side and you were overcompensating on the other side, and that caused sciatica, right? So for some people, sciatica is actually a pelvic floor problem because two of the muscles that are pelvic floor muscles attach to the hip.
I remember the green muscle.
The green, yeah.
On your YouTube video.
Yeah, so it's called the obturator internus muscle. And then there's another muscle called the piriformis. So a lot of people might have piriformis syndrome.
Yeah.
But they'll go and they'll get their piriformis worked on, but that won't change the sciatica, or it won't completely make it go away.
Yeah.
So the other muscle, which is a pelvic floor muscle, is the obturator internus. And that can actually press on the sciatic nerve and cause sciatica too. So we actually see a lot of orthopedic patients, whether they're labral issues, hip labral issues, hip replacements, groin pain, a lot of them will actually end up having pelvic floor dysfunction. So back pain, hip pain, groin pain, pubic bone pain, tailbone pain. If you have any of those symptoms, there most likely is a pelvic floor issue that might be in the mix. Now, from an other standpoint, so any sort of bladder frequency, bladder pain, painful urination, all of those can also be a pelvic floor symptom. So if you've gone to your urologist and they're not finding anything, you don't have a UTI, but it feels like a UTI, or it feels like a yeast infection, that can all still be pelvic floor, because tight muscles can actually mimic those symptoms. So for anyone who's having sexual pain, like I mentioned, yeast infection, pain with tampons, unable to have a gynecologic exam, those patients most likely have a pelvic floor issue that's also involved in what's going on. Anyone who has endometriosis, something called interstitial cystitis, irritable bowel, they can end up having a pelvic floor issue. And then anyone who has like chronic constipation can also have issues there.
Wow.
Pain with sitting. So anyone who has pain like in their perineum or their sit bones with sitting can have a pelvic floor issue. Abdominal pain that, like feels like a ovarian pain. So lower abdominal issues can be pelvic floor. Yeah. The list goes on and on, but that's just like a, vulvar pain. So just even pain that feels like it's vaginal and the vaginal opening, rectal pain. Yeah.
Wow.
Yeah.
So that's why it's important to find a specialist.
Yeah. Someone who knows about pelvic floor.
Yes. And that leads me into you speak of your practice.
Yeah, so we're going on 15 years that we've been in practice. And so our practice, we see a lot of chronic orthopedic as well as pelvic floor dysfunction. So whether it's pain, whether it's incontinence, whether it's prolapse, or any of the things that I listed. And our goal, because again, 15 years ago, a lot of people weren't integrating the body together. And so our goal at our practice was, you're a whole person, you're a whole being, you're not one body part. So we're going to treat you that way because everything is interconnected. Just from this little short time that we've been talking, we're seeing there's connections with pelvic floor muscles to the hip and the back and all of this. So we look at everyone in this way where we're, you know, if someone's coming in for back pain, we're looking at their hip, we're looking at their abdomen, we're looking at their possibly their pelvic floor, and looking at everything to see the whole picture. And so we're a very hands-on practice, meaning we're not like traditional physical therapy where most people, if they've had any experience where they're going in and they're doing like a lot of strengthening exercises, a lot of stretching exercises, and that's their whole PT session. With us, when you come in, it's all body work to try and get the body balanced, to get everything aligned properly, to work on trigger points, myofascia, to balance everything out. And when you have a better balanced system, the foundation of your house, right? The foundation of your body is much better so it can resist like all the insults that come to you on a daily basis. So I always say, I'm like, if the foundation of the house is not good, then a tornado or a strong wind gust is going to affect it. Same with the body. If the body is aligned better and it's strong and everything is well balanced, then it's going to be able to tolerate injuries and any, you know, a lot of other things that come your way.
Or rebalance. Or
That's why it's called rebalance. Yeah. So ours is a lot of most of our work that we do is a lot of hands-on body work, and then we'll teach you the strengthening and the exercises and the stretches that you need to do. And most people will choose to do those concentrated pieces at home and let us do the work you can't do.
Yeah. Do you guys accept insurance?
So we are a concierge practice. Reason why we do that is because insurance companies won't let you treat more than one body part at a time. And because we work in this holistic manner, this allows us to do what we need to do without the insurance is basically saying, we're not going to pay you for that. But the nice thing is that most people, if they have out-of-network coverage, that most people, once they meet their deductible, they get anywhere from 40 to 80% back. So nice. They do get reimbursement.
Some reimbursement
back. And you can also use like your HSA, your FSA account.
So you have 2 locations.
I do. I have 2.
One in Central City. The second one is?
Yeah, one here is Center City, and the other one is in Narberth, which is like 8 miles outside of the city. So we have a suburb location. And that's our main location.
Nice.
And our Center City is like our satellite location.
Oh, my gosh. I'm going to be one of her patients or client. Okay, for sure, because I do need some work in that area, for sure. So, where they can find you, Hina? Share where they can find you. YouTube is a great resource, ladies. So make sure you follow her on YouTube. But share with us.
Yes. So you can come to our website. It's rebalancept.com.
Okay.
All of our information is there. But yes, we do have a pretty robust YouTube channel where we try to talk about anything and everything.
I love it.
You know, where if our patients ask us something, we'll try and create a YouTube video on it.
I love it. Yeah. And she uses the anatomy little how we call that? I forgot.
Like the pelvic floor models.
Pelvic floor models.
Yeah.
And so visually, it's very helpful to see it, to understand it.
Yeah.
And you also use a lot of the printed, colorful muscle structure. And I really love the way you explain things. You really get like complex concepts. You break it down for us to understand the functionality and the importance of these different systems in our body. So first time I met you in this panel, when she was explaining things, I was like, oh, I really like the way she explains, because in a room of highly educated people that understand these terms, it's just easier to have conversations, as I witnessed there with other doctors.
Yep.
And I was like, yeah, but there's a lot of people don't understand what you're saying.
Yeah.
So when you were speaking, I was like, oh my gosh, it makes so much sense. And there's a lot of people that, as you mentioned before, and as I mentioned too, social media had kind of created a bridge to more knowledge, where we're more empowered to make the decisions because we have access to information. But when it comes to our bodies, as much as we consume information, we're not connected with our bodies. Therefore, we don't understand it. So when you have someone like you that visually like shows the muscles around the pelvic floor and how they are connected and how they can be causing the lack of attention, can be the cause of the problem, and that's what I love about your content and about you.
Thank you.
So please follow Hina everywhere on Instagram, YouTube, TikTok as well,
Facebook.
Yes,
yeah.
Awesome. Thank you so much for coming today,
thank you
Hina.
so
It was
much
a pleasure.
Thanks for inviting me.
And
this is so
hopefully
fun.
we can do it again.
I would love
another
it.
time.
Yeah.
Okay.
Definitely.
All right, Bonita. So I see you on the next episode of Be Bonita podcast. Ciao.